Did you know that the geographic center of New York City lies right at the doorstep of Wyckoff Heights Medical Center on Stockholm Street in Bushwick? Trivial, but true. What's also true, but not trivial, is that Wyckoff is one of 4 hospitals in Brooklyn on the state's watch list of health facilities facing financial crisis. In a borough whose population has swelled, even as it has seen several hospitals close forever, and that is home to 3 major facilities in the financially challenged public health system, the future of healthcare in Brooklyn is linked to the fate of those at-risk hospitals. Today, I'm joined by some of the experts and advocates working to preserve hospital care in this borough amid a changing health marketplace. One of them is Ryan Lynch, the policy director for Brooklyn Borough President Eric Adams. Welcome, Ryan.
Thanks for having me.
We're also very pleased to have 2 members of the Commission on the Public Health System, Judy Wessler, thanks so much for coming on, and Maurice Reid. Thank you so much for being here. So Ryan, talk to us about an overview. Are we talking about a system with growing pains? Are we talking about a crisis? How would you characterize the hospital situation in the borough at the moment?
I mean, I think if you look at the hospital situation over the course of a trend line over the past 10 or so years, you mentioned hospitals closing, the reduction of beds, the crisis amongst the private healthcare system, and the reason for this Northwell study that's being conducted right now, and on the H&H hospital system, the mayor's infusion of $2 billion into the system. We're seeing that this is as the borough is growing, the healthcare system isn't growing with the borough. There's been a trend towards consolidation, and inordinately that impacts communities of color and low-income communities. So what we're trying to do at Borough Hall is really to raise hackles and raise awareness that this is an issue that needs to be addressed. What we're doing currently is a good step in terms of influx of funding to H&H hospitals, taking a hard look at the struggling private sector hospitals. But we clearly need to do more. We need more healthcare and more hospital beds, not less healthcare in a borough that's growing. If you just look at downtown Brooklyn alone over the past 13 years or so, the population growth grew by 13%. That's incredible. I'm sorry, 17%. That's incredible. But at the same time, you lose Long Island College Hospital and all those beds that are there. So what are we going to do to support the healthcare system, support the residents with a healthcare system that they deserve?
So Judy, what's driving these changes, broadly speaking? What is forcing this moment to arrive?
So much. There are issues about funding. I've been working on trying to get a definition of safety net hospitals so that they would be targeted for more funding. There's actually a bill moving through the state legislature right now, and all of the, quote, at-risk Brooklyn hospitals would be eligible for additional Medicaid funding. The practices of the state are pretty discriminatory against safety net providers and very much directed toward the big guys, I call them, like Northwell, that are moving in and taking over and not necessarily providing the care that's needed.
Is part of this, and anybody jump in on this, that healthcare in the hospital setting is moving away from overnight stays to outpatient, or at least, if not the practice of medicine, that the payment for medicine is changing models? Is that part of the picture in Brooklyn?
That is a part of it. It is a financial crisis, more than a service crisis. As Judy was saying, the reimbursement process for the hospital is so disproportionate in terms of Brooklyn hospitals getting their fair share that creates a situation where it is very difficult to provide care on an ongoing basis. So the first thing that has to be done is to change that. I think if they do that, then the hospitals can begin to survive and improve their extension. Working with federally qualified health centers and existing community-based organizations is another option, where you don't have to create brand new facilities, but you can extend the services to the community through collaboration.
So the closures that I talked about in the top, and they go back several years, I think 2003 was one of the first ones. We've seen several hospitals shut the doors forever. Have you noticed an impact on communities? Is there a discernible impact on people's health? Absolutely. And what exactly does that look like? I mean, folks might say they just go to the next closest hospital and that's it.
They don't. And the best example, in St. Mary's Hospital closed. There were, if I recall the numbers now, about 18,000 people on their roster. After 5 years of searching, they could not find about 10,000 of those people in the health system. So what happened? We don't know. So that's the kind of impact, clearly, in terms of the community.
Ryan, you talked about the Northwell study, which is the former North Shore Long Island Jewish health system that's looking at some of these hospitals on the at-risk list and is engaged in a study. Can you talk a little bit about what that looks like?
So as far as we know, that Northwell it's through an allocation of funding from the state, is going to these at-risk hospitals, learning about the issues and trying to identify recommendations to move forward to strengthen the hospital system. What the borough president is primarily concerned with is ensuring that there's a loud community voice in that process. You know, the fact of the matter is that the hospitals that are serving these communities are struggling, but these are lifeline hospitals for residents, and residents need to have that voice in that process. The borough president is also very interested in sort of thinking innovatively about in this study about how do we find symbiotic relationships in healthcare and in dealing with some of our affordable housing crisis. We are talking about pushing for grandparent housing in and around some of these sites. In a way that seniors raising grandchildren or grandparents raising grandchildren need housing. And a lot of the senior-assisted housing, they don't allow children under the age of 18. So we think that potentially putting grandparent housing, filling that donut hole where seniors that are raising their grandchildren are falling through, could help create a symbiotic relationship with the hospitals nearby.
So when we talk about forming a new kind of hospital network, which is one possibility of that, around the city, I think, Judy, maybe around the country too, consolidation has been the order of the day. Not so much hospitals closing, but independent hospitals becoming part of larger corporate behemoths, you might say. Obviously, the argument for that is that it makes things more efficient. I'm assuming there probably is a downside. Allegedly.
Yes.
You might take issue with that.
There have been at least 2 or 3 studies that show that these consolidations tend to increase the cost of care by 20%, and it does not necessarily. The studies don't show an improvement in quality of care, which is the other reason that's given for doing this. And what you lose is the community focus, the culture of an institution that matches that community. And we see that very much. Maurice and I have both been involved in the fight to save and transform Interfaith. And, it's now well on the road to being quite an incredible institution with new executive director and the like. But if you take that away, the potential loss could be amazing. Northwell is a nice Long Island institution, North Shore. They didn't even make the definition of safety net, very low definition that was set by the state. So, we're talking about different worlds, different cultures, and that could be very problematic.
Is that a concern for the borough presidents as well?
Well, I think that we're concerned with ensuring that voice, that community voice is in this process. This is a process that I believe began about 2 or 3 weeks ago. It's ongoing, and we need to have those community residents involved in that process in a real way. I think one other issue that the borough president is very happy to have seen happen in the Assembly is the safe staffing legislation passed the Assembly. And to Judy's point, when you look at research that talks about safe staffing levels, nursing levels, you're seeing that those hospitals are having better outcomes because they're seeing fewer readmission rates, which drives down costs for hospitals. And in a comparable state like California, where they have a safe staffing law, you're seeing that no hospital has closed since 2003 in California. So I think we need to think very innovatively about this trend and find out what are mitigating ways that we can kind of find efficiencies, but do our best to ensure that the hospitals in low-income and communities of need remain.
Maurice, one of the more jarring incidents in this longer story is the closing of LICH. And that site, as we all know, is now the subject of debate about what sort of real estate project should occur there. Does that question of what that site will look like, does that have a health care implication? I think there's supposed to be some sort of health facility regardless of what gets built, right?
Yeah, and we're not sure what that's going to be.
Yeah, what are your questions as that process rolls out?
Yeah, and our implications, especially from the viewpoint of the Coalition Transform Interfaith, where we went through that struggle to to save interfaith at the same time, we're very concerned about the Northwell study, that it's not just a cover to effectively close hospitals in Brooklyn. We're really sincerely hoping that they'll listen to the input that is being provided by the community residents at this point, and to see the progress that has been made in interfaith in just a few months under new administration in collaboration with the work of the community. That's the approach that needs to be taken in the community-based hospitals.
And can I do a little commercial? This coming Tuesday night, the big shots from the state, the health commissioner and the deputy secretary for health for the governor, will be coming to hear from the interfaith community. And the meeting will be at Restoration Plaza at 5 o'clock, I believe.
Okay.
And so everybody, who has an interest should come out and speak up. There was one at around Brookdale this week, and lots of community people came and spoke. It was really wonderful. There were some extraordinary ideas that I saw the state people writing down because they hadn't thought about them. And the Northwell people were there also taking notes. So, there's lots to learn from the community, and they need to be heard.
Let's talk about the public hospitals for a minute or two. 3 major facilities, as we said, in Brooklyn, Coney Island, Woodhull, and Kings County, if I'm correct. The mayor, as you mentioned, announced a $2 billion plan to help shore up those hospitals. I think the operative word there is help shore up. What else will need to occur for that to work? It's a plan that focuses on improving community clinics, promises no closures, no layoffs. Is that realistic? What's it going to take to make that work?
I think there's no closure or layoff until after the next election, but I didn't say that. And there's a big concern because there are at least 2 facilities, not in Brooklyn, that have been talked about as not closing the hospital. The hospital building will be there, but not necessarily the services. So, it's a catch-22 and interesting language.
What do you think, Ryan?
I mean, I think the $2 billion is a good first step, but clearly more is necessary. The borough president thinks that one of the most important things that is needed for H&H or HHC, I still am trying to get the moniker down, is to get their positive messages of success out there. H&H is viewed as a hospital system of last resort. There's a certain stigma, but if there's an opportunity to get those positive messages to highlight the successes that they've done, and in one study they found that their continuum of care for diabetes and glucose was wildly successful because of wraparound care. So getting those stories out there and touting those stories so that it becomes not just a hospital of last resort, but you can attract choice patients as well would be a good step. But also trying to find efficiencies, doing more to support preventative health care. The borough president is working very hard to hold seminars and workshops on preventative care. We just had a DOH-MH roundtable today on sexual history and STDs. So getting information out about that, workshops, seminars on those types of things. But also, we're about to launch is it an emergency initiative? So trying to reduce the burden on emergency departments, many of which the H&H hospitals are the ones that residents are going to because they don't have health insurance. So identifying those alternative facilities, the FHQCs, the urgent care facilities, ambulatory surgery facilities that can accommodate non-life-threatening, non-emergency situations and reduce that overall cost burden on H&H hospitals.
Last question is to you, Maurice. He just mentioned people without insurance, and if you gave anyone in America a word association test and said healthcare, they'd say Obamacare. What has the impact of the Affordable Care Act been on this issue of hospital usage, hospital closings, hospital finances? Good, bad, mixed? What's been the result?
Well, in terms of the number of people covered, it's been great. The numbers of folks in insurance has increased tremendously. Nationally, it's over, 20 million people that have actually been enrolled. So that's a tremendous. Health care should not be an issue for a person. They shouldn't have to make a decision about feeding their family or getting health care. And so the necessity for public hospital systems and hospitals that provide care to the underprivileged community is critical. $2 million for the health and hospital system, that's a laugh. I mean, be serious about the need and the service that's being provided by those hospitals and the quality of health that it means for the entire borough of Brooklyn. It's just not Bed-Stuy or Brownsville. It's the entire borough of Brooklyn that benefits from the success of the public hospital systems, together with the small community hospitals. We cannot see these behemoths that comes in from outside that have no clue about what's going on in the community, the culture of the community, and really just see this as a business. You know, they don't create the kind of health care that's necessary for success.
Ryan, very quickly, what do you think the impact of ACA has been on the hospital situation?
I would echo Maurice's comments. You know, incredible amount of people covered. You know, but the thing is, that was a step towards improving our healthcare system to match those in the rest of the world. So I agree wholeheartedly. Ditto. It's simply ditto.
Well, I want to thank you all for coming. I think we have to end it there. I want to congratulate. Nobody here used a medical metaphor once. No one said vital signs or diagnosis. It was tough, but I hung on. Thank you for coming. We'll have you back soon.